speaker. So I'd like to introduce Mathew Gould, who's the Chief Exec of NHSX, and we're delighted to have you join us, Mathew.
Thank you, and thank you to all the previous speakers. It's really good to hear everything that everyone is working on so positively. Let's go back a few months, where at the start of the year we were feeling quite pleased with ourselves. We had our budgets all lined up, ready to go for the start of the new financial year. We had our programs ready to go. We had a series of activities that we were all ready to press go on, and then events happened, and we ended up focusing, really, as everyone, on how to deal with the pandemic and dealing with the disruption and the requirements of the moment. One of the positives that has come out of it, which I know has been much talked about, has been the extraordinary steps taken on digital transformation across the system at a speed that people really didn't think was going to be possible beforehand, to a scale that a lot of people thought we'd never reach. And to run through a few examples, first of all, the use of data, both nationally and locally across the system, the way that we've been able to get data to flow safely, but in a way which can help both the people managing the NHS's response and individual clinicians for individual patients, the way we've been able to get the data to flow better, more effectively, I think has been really helpful. The approach to information governance, I think, is extremely telling. One of the things that I'm proudest of about the NHSX response to the crisis was the one page of guidance we put out right at the start, which was incredibly straightforward, couched in very simple, empowering terms, endorsed by the Information Commissioner and the National Data Guardian, that basically just said, if you do the right thing, if you're treating patients in good faith and you're sensible, then it'll be fine, and get on with it. And right the way across the system, I've heard echoes of that and the impact that it's had. Yesterday, for example, I was down in Devon, and they were saying to me that a mental health trust in Exeter had heard that guidance and it had liberated them. And there's something around what happened then that we need to capture. There were other things that we did. At one stage, it became very clear that the channel shift that had happened at such pace across the system had resulted in a huge shortage of laptops. So we've sourced 40,000 and shipped them into the system at breakneck speed. And then there was the channel shift itself, the move to remote consultations, both in primary and secondary care, which happened unbelievably fast and remarkably smoothly. Underpinning all of this was a sort of can-do attitude, which showed actually what you can do with a bit of help from some of the emergency regulations and the rules around a public health emergency. But really what drove all of this was a very strong sense of shared purpose and a sense of urgency and a knowledge that this was a moment just for getting on with it. And the single best thing I think we can do is bottle that and find a way to preserve it and make clear to the system, please carry on doing it, carry on trying stuff and taking the steps that you've taken safely and sensibly and so forth, but let's not go back to where we were. Some of what now the next stage will be entrenching and really sort of locking in the progress that we've made. For example, on the shift to digital channels for consultations. Some areas I think we need to take the progress that we've made and work out what the next chapter looks like. For example, around how we share, what the appropriate way to carry on sharing data is that keeps the profession and the public with us, but really builds on the progress that we've made, and how we put out guidance on information governance, which for peacetime as well as for the pandemic, which are as simple, empowering, easy to understand, easy to navigate as the guidance we put out at the start of the pandemic. And then there's a range of areas where I think we need to build on what we've done, where we've only really just started. So one of the really exciting things for me isn't channel shift, it's transforming the way that we do consultations, reimagining clinical pathways so that we use digital tools like remote monitoring, for example, to be able to offer better and different care to people who won't have to go into face-to-face appointments or even appointments online or on the phone, because we have other ways of connecting them, triaging them, looking after them and making sure that they stay and become well. So there is I think real progress over the last few months, extraordinary progress in certain respects, a very exciting agenda for the next few months. And I wanted just to say a couple of minutes about where I want NHSX's focus to be. There is a body of work which we're calling Joining Up Care, which I think is really important and urgent, particularly given the possibility of a second wave, the fact that we're likely come the winter to be dealing with a difficult and stressed situation, and with everything that we've learned around the need to break down barriers in health, between health and care and between different care settings. I want the focus of NHSX's work to be on this joining up care agenda, which means finding ways to get data to flow safely between different care settings. So building out the network of shared care records across the country. I want us to build on the remote monitoring work that's happened as part of the NHS at Home initiative. I want us to invest in trying to drive change in the digitisation in the social care sector, in care homes and among care providers, because we've learned over the last few months how important that is. And all of that needs to be underpinned by, I think, a series of fundamental building blocks, all of which I've talked about before, all of which are familiar, but the importance of which I think has been reinforced by the last few months. We've said for a while that we want to put out guidance on what we've called what good looks like. So giving guidance to systems and providers across the NHS and care around what it means to be good at digital and digital transformation, because at the moment that guidance is striking by its absence. I think we need clarity around who pays for what, which sounds really straightforward, but I worry that we've accidentally at times sent out the wrong signals around, if you just wait for money from the centre, it'll save you from having to invest if you're a trust or a system or whatever. And I think we need to get clarity on that. I've mentioned IG. I think there's a burning need for really simple, straightforward, easy to navigate guidance. And all of this needs to be underpinned by some core interoperability standards, which speaks to some of the earlier discussions you've had. All of this is a massive opportunity for the NHS, for social care, and I think if we can get it right, for our health tech sector and everyone on the call, because the improvements that your innovation can bring the NHS and care, the increased productivity, the improved experience for citizens, the improved experience for clinicians and staff, I think are never more necessary than they are now. In all of this, we're going to have to be really careful and really mindful of the risk that digital technology, though it will be brilliant for most, might exacerbate inequalities for some. So I think there will always be, and again, the last few months has reinforced this, a part of what we do, which is about about helping those who aren't online, who are digitally excluded, to make sure that we don't accidentally exacerbate inequalities by the progress that we're making. But overall, I think it's been for everyone, for the country, and particularly for the NHS, an incredibly tough few months. But the steps forward that it has created, and that everyone on the call has been part of, in terms of the digital transformation, is definitely one of the silver linings, and we are determined over the next few months to build on it.
Great, thank you very much, Matthew. Well, there's quite a number of questions that have come in, so I'm just going to move straight to the questions. So the first one is around how we can get the care sector and the health sector to work more closely together. And I know that's some of the work that you referenced in the future work for NHSX. And I'll just quickly mention that the second couple, we have a question around, you mentioned you were about to press the button on some programmes of work. What were the work programmes you were about to press the button on before COVID? And then the final one was around how we can get better about sharing success stories. I wondered if you had a view on that, and I think I might after you've spoken, I might loop back to Tara on that one as well.
Yeah, look, they're great questions. I mean, how do you break down barriers between health and care? I mean, this is one of the eternal questions. It's not at all straightforward. I think, look, in the care sector, you have what? I mean, 15,000 odd providers, a third roughly are basically digitised, a third have a mixed economy of digital and paper, and a third are entirely undigitised. I think we can play collectively a big part in breaking down barriers by helping to get the third that's undigitized and the third that's only semi-digitized to a point where it's more digitized. They have basic infrastructure in place. We've been working with the telecoms companies to improve connectivity to the many care settings that don't have sufficient connectivity. That's some brilliant work that Tara's been leading. And then I think it'll be a different approach to the one we take in the NHS, because obviously these are a lot of private, often charitable providers rather than sort of state. But I think a similar approach, in as much as setting out standards, building up good practice, sharing good practice, finding ways to bring the sector up in terms of its sort of digital maturity, and then having the mechanisms to share data across safely across care settings. And I mean, as I travel around the country, the bits of it that are really impressive are those places that have a shared care record or the equivalent that allows data to sensibly be shared between GPs and care homes and hospitals and trusts, so that care can be done in a much more joined up way. And when that happens, it's incredibly impressive. And when it doesn't happen, it's often, I mean, at really tragic cost. So look, there's a ton of stuff we can do there. None of it will be easy, but I'm confident that we've got an understanding of what needs to be done and an understanding of how important it is. In terms of some of the things we were ready to go on, I mean, look, some of them are the things we've announced that we're still really keen to do. We were desperately keen to start work, for example, on single sign-on and improving login times across the NHS, which continues to be a bugbear for any number of NHS staff. We were and remain really keen to take forward our programme of digital aspirants, so helping trusts across the system that aren't in that top quartile, who haven't been global digital exemplars or their fast followers, but nonetheless have aspirations to improve their own digital maturity and use digital technology to transform, to help them do that. We're still keen to do that, but I mean, improving digital infrastructure, going live on EPRs and things like that. I mean, this is the last few months has been a difficult time to try and do a big go live. So some of it, we're keen to take it forward, but some of it has paused. In terms of sharing success, I mean, definitely. The NHS is not good news or good practice and innovative practice doesn't sort of propagate across the NHS to the degree and at the speed we would like it to. We know that. I know it's something that you, Lisa and Tara, are keen to help with on the innovation front. It's also something I've asked our new CIO, Sonia Patel, who joined us a month or so ago from Norfolk Park and Hillingdon Trusts, to focus on, which is how do we make sure that good practice and knowledge spreads more effectively? Because there is a ton of good practice out there, and people on the call know because they've created a vast amount of it. There are pockets of brilliant innovation, and one of the deep frustrations is that innovation doesn't spread the way it ought to, and we need to try and find ways to do that better, and part of that is sharing success.